guys, welcome back to the channel. Last class we have started with central giant cell tumor. We have seen that they are benign but aggressively destructive osteolytic lesion. We have seen that it seems to represent osteoclastic origin. They are not unique to the jaw and are not odontogenic, and they have osteoclast receptor, and the zygid represent osteoclast precursors or osteoblasts themselves. We will be continuing this. Okay. These central giant cell tumor is histopathologically and behaviorally identical to the benign giant cell tumor of the long bone. तो जो लॉन्ग बोन में बेनाइन जाइंट सेल ट्यूमर मिलते हैं वो वैसे ही होते हैं सेंट्रल जाइंट सेल ट्यूमर ऑफ जॉ. इन जॉज इट प्रेजेंट एज अ पेनलेस clinical expansion that may have a short ascendancy, that is कि short मतलब 2 week to 2 month के लिए, and they present as a painless expansion. Okay. Expanded lesions occur blue because of cortical and mucosal thinning and internal vascularity. जो लीजन्स होते हैं जॉज में वो एक्सपैंडेड होते हैं एंड दे अपीयर ब्लू बिकॉज क्या होता है जो म्यूकोजल और कॉर्टिकल होता है वो थिन आउट हो जाता है, थिनिंग हो जाती है तो पतला हो जाता है, तो नीचे की जो वस्कुलैरिटी होती है वो दिखती है, तो दैट्स वाई इट अपीयर्स ब्लू. Now peak occurrence is at the age of 5 and 15 years and it may be in 20s and 30s, but peak occurrence is at the age of 5 and 15 years. Women are affected twice as men and mandible is involved 3 times more as maxilla. तो women and mandible का predilection है इसमें, and it is 3 times more involved and they are twice more affected. Now lesion cross midline and generally occurs in anterior region. Anterior region में generally होते हैं but can be appreciated in posterior region also. Now coming to differential diagnosis, what can be the differential diagnosis of central giant cell tumor? First is OKC, that is odontogenic keratosis. Second is odontogenic myxoma, and third is ameloblastic fibroma. All these three are differential diagnosis when it's occurring in child or teenager, and when it is at the age of 14 or 15 years, the differential diagnosis will be a central arteriovenous hemangioma or a ameloblastoma. Okay. It also appears multilocular. Okay. मतलब all the multilocular radiolucency are the differential diagnosis. Now coming to radiographic finding, it is a multilocular radiolucent lesion. Multilocular है इसलिए soap bubble appearance दिखेगा radiograph पे. Now it thins cortices including inferior border. Thinning तो हम लोग देखें कि it causes thinning इसलिए वो bluish clinically भी दिखता है. Now scalloping of inferior border, displacement of the teeth, resorption of interradicular bone and tooth root to some degree. अब ये क्या होता है, थिनिंग करता है, स्कैलोपिंग करता है, तो इट रीचेज द alveolar बोन ब्रेक करके इट रीचेज द इंटररेडिकुलर बोन, तो इट कॉजेज डिस्प्लेसमेंट ऑफ टीथ, रिजॉर्प्शन ऑफ इंटररेडिकुलर बोन एंड टूथ रूट टू सम डिग्री. Now coming to diagnostic workup, first is approached first with the goal of ruling out a high vascular या high pressure vascular lesion. सबसे पहले we should rule out कि it is not a high pressure vascular lesion. अगर हम लोग ये rule out नहीं कर पाएंगे तो bleeding इतनी होगी it will be out of control. Once it is ruled out, because central giant cell tumor is not a high pressure vascular lesion and it will either fail to return blood or will return only small amount of blood, so we have to rule out it is not a high pressure vascular lesion. Now coming to an incisional biopsy is then performed. When we have ruled out, we'll perform an incisional biopsy. We'll be able to see a red brown friable tissue. If lesion is small, thoroughly curate the entire lesion. अगर lesion छोटा है और access अच्छा है तो we can curate the entire lesion. Now, if lesion is determined to be any type of a giant cell tumor, it is prudent to obtain a serum calcium to rule out both primary and secondary hyperparathyroidism. अगर हम लोग बायोप्सी कर लिए, सब हो गया, हमको पता चल गया कि ये giant cell है, तो we should also do one serum calcium, ताकि we will be able to rule out both primary and secondary hyperparathyroidism. Okay, that's all for today. We'll be continuing this in next class. Till then, like, share, subscribe and comment. Bye.